So my name's Jude, and I have 39 years lived experience of Trichotillomania, which is a body-focused reflective behaviour, and I have a PhD which looked at attitudes towards and attentional biases in Trichotillomania. So I tend to come with a few hats when I'm talking about this area.
Wonderful, thank you.
I'm Caroline. I also have Trichotillomania, hair pulling disorder, and I've had that basically my whole life. I'm doing my PhD at the moment, unfortunately not in BFRBs, but in habitual behaviours. And I also am on the committee of BFRB UK and Ireland with Jude. Okay, so what are the BFRBs? Well, it stands for body focused repetitive behaviours, and basically a BFRB is any sort of behaviour that you can't stop doing. There are many. For example, you might find you biting your lips, you might find you bite your cheeks, you bite your nails, and maybe you pull your hair or you pick your skin. If you're finding that you have an irresistible urge to engage in a behaviour on your body that's difficult to stop once you start, you may have to some extent a body-focused repetitive behaviour.
This is a thing in DSM, so the Diagnostic Statistical Manual. This is a disorder, so it's kind of categorized as not something that everybody experiences. So I guess my question, following on from what you said there, Jude, is surely isn't this something that all of us do? When does it become a disordered behaviour?
So obviously pulling your hair, picking your skin, it's very natural. You see a grey hair, you want to pull it, you have a pimple, you want to pop it. It's very, very natural behaviour. But when it gets to the stage where you can't stop yourself doing it, despite really wanting to stop yourself doing it, are you doing it to the point where you're feeling distressed? Is it causing you anxiety? Is it causing you shame? Are you feeling depressed? Then it's going more into a disorder rather than a normal everyday behaviour.
So I guess, as with any mental health condition, it's something that you can move into the disordered state and then move back into more of a normal state, as you can with anxiety or depression or all sorts of other kind of spectrum conditions. Is there something also in there about kind of not even knowing you're doing it?
So awareness or lack of awareness is a pretty big deal when it comes to body focused repetitive behaviours. You can be driving your car, you can be watching TV, and suddenly you realise, I'm going to use hair pulling as an example, you may realise that you have had your hand in your hair for the last few minutes, and in some cases hours. Yeah, for many, many people, they will find it's even described as people with BFRBs can end up in a trance-like state. So they're in this state where they're constantly pulling their hair, picking their skin, and they don't quite realise they're doing it. They get locked into this repetitive behaviour that they can't get out of. But then there are also times, say for example, where you're feeling this very strong urge that I really, really want to pull this one specific hair, and then you might find yourself going into a bathroom, picking up some tweezers, and consciously going to a mirror and pulling them out. So there's both. There's what we would call, I guess, automatic pulling, where it's very below your level of consciousness, or focus. But there are arguments against those definitions, as we've heard today.
Can you tell us a bit about the relationship between the kind of urge and the relief or the pleasure that you get? I'm thinking it reminds me a lot of kind of people talking about self-harm behaviour. So how is it different? So if somebody's really anxious and they cut themselves to relieve themselves, how is this different from that?
Yes, I guess what we tend to say when trying to describe the difference between the self-harm and BFRBs is the harm that comes from self-harming is intentional. The harm that comes from body-focused repetitive behaviours is unintentional. So when someone self-harms, they are consciously deciding to harm themselves to relieve a negative emotion. Whereas with body-focused repetitive behaviours, we're carrying out this behaviour that we can't stop ourselves from doing it. Maybe in response to negative emotion, it doesn't have to be. This could be, as we said, outside of your conscious awareness. But the harm that comes, the ball patches, the scabs, the cuts, all of that, that's a byproduct of the behaviour, and that is not an intentional thing that people with BFRBs are trying to do.